Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. And as always, if you like what you see and hear, subscribe, leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, it is my very great pleasure to welcome Shedrach Ado out of Nigeria. Shedrach is a registered nurse. He's the founder of Reaching the Unreached initiative. He's a field nurse with a wildlife and conservation organization. He says that he's passionate about nurse-led leadership, and he has a vision to help build a future where quality healthcare is accessible to everyone, regardless of where they live or their socioeconomic status. So, welcome, Shedrach.
Thank you, Dale. Thank you very much.
First of all, I want to know what brought you to nursing? Who or what inspired you?
Um, Once again, thank you for the opportunity to actually take part in this wonderful session.
Mm-hmm.
Now, I would say there was no there was I didn't get a direct inspiration to join nursing. Nursing was the only option I had as at then. So I just had to take it. But
Uh-huh.
going into the studies, I discovered that there is more purpose for me in nursing than I thought. I was going into nursing as a career path, but
Mm-hmm.
when I went in, I discovered that it is more than just a career. It is a way of fulfilling my own purpose in life.
Mm-hmm. Oh, all right. So you went into nursing as this is the only path available to me right now. How did that challenge you?
Yeah, yeah. It was very challenging because at first I wasn't looking at it. I was just looking at I will just do this and later on I will do what I want to do. But since
Yeah.
it's really available, for nurses who have gone through nursing education, nursing education is quite challenging. So while the challenges come, I still feel like this is not what I want to do. But let me
Mm-hmm.
just get through it. Later, I will up my game and do what I want to do.
Yeah, I see. So here's the question though. You
Yeah,
you here you are, you're going to nursing, you think you're going to just, bide your time and get through it, get the qualification, do what you want to do. And now then you go and you you found an organization, Reaching the Unreached. Um,
yeah.
what made you do that?
All right. Reaching your reach is actually okay. Let me just go by how it started. Reaching your reach
Hmm.
after nursing school, I started going house by house in my neighborhood. I started going house by house, checking people's blood pressure, checking their sugar level, and giving them health tips, minor
Yeah.
health tips. Everything changed in 2023 when I decided to give back to the community entirely. So I organized a free medical outreach. I invited my friends who came in as volunteers. I provided drugs and other items needed for various other investigations and invited people beyond my immediate community. People from other neighborhood were invited and they all came in for the free medical outreach, free health education sessions, free medications. It was supposed to be a 1 day something. It was on my birthday. So I felt like this particular birthday I want to actually give back to the community instead of just
Okay.
celebrating it.
Yeah.
Then after the outreach, I saw how many people were impacted, the impact that was made. Then I felt like there could be more to this. More people could be reached. I also discovered that many people suffer from illnesses and diseases that are actually preventable. Some
Preventable.
of this, my immediate community are having this issue. How many more communities are having such issues? So that led to founding the Reaching Your Rich initiative. After the outreach, we didn't stop. We kept going on and on to the streets, to the market, to other underdeserved communities, actually.
Mm-hmm. Mm-hmm.
Yeah.
So now you're talking about we. So I'm presuming now that you have a fair size organization.
Yes, I know. I have a team member. I have team members. I have volunteers that actually work with me. I don't do it alone, though I founded it, but I still have
Yeah.
people that volunteer. I can't actually be everywhere. I can't be dispensing
Right,
drug and also
exactly.
yeah, actually.
Yeah, yeah. And so there's one thing, there's one comment I want to make about this because very often, when it's our birthday, people are looking to give us and we're looking to receive,
Yeah,
acknowledgement of our birthday, whether it's by gifts, whether it's by, a card, whether it's by just somebody wishing us well. You took
yeah,
the other path and you say, it's my birthday, so I am going to give to others. That's huge.
yeah,
That's
yeah.
huge. I love that idea.
Thank you, thank you,
I love
thank you,
that. hmm
thank you.
So here is the thing also. When you talk of nursing, one of the reasons that I do this channel actually is that when you speak of nursing, people immediately envision hospitals, institutions, nursing homes, that kind of thing. And I really want people to know that nurses work anywhere and everywhere and outside of those institutions. So
Yeah.
what in your journey as nursing that inspired you then to go outside of that? You now work I said you work in wildlife and conservation.
Yeah.
How did you make that leap?
All right. So I've been someone that is very optimistic. I don't see things the way people see things. I don't know, but if people are looking at this direction, I tend to envision more. I tend to envision more aspects, more ways to do things. So even before working in a wildlife conservation environment, I worked as a call center nurse where I work from home. It was different for people. Like most people, once they know that you're a nurse, but they don't see me in the hospital. You only see me with my laptop and my headset, and I
Mhm.
I take calls for clients. It was something different, but I dared to do something different. I when you follow the crowd to do things in normal conventional way, things will continue being the way it is. I notice I wouldn't want to talk about some of the challenges in nursing because I think we're going to get there, but the challenges in nursing, especially in Nigeria, it demands you to actually do things differently because if you follow everyone to do things the same way, we
Yeah,
are not going to get needed change actually.
yeah, 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 yeah. Actually, that's I love that view. I love that view. I love that view. So tell me what's a typical day for you in wildlife and conservation?
Yeah, actually, it has been an eye opener for me. Because just like I said, I worked as a call center nurse before moving to the wildlife and conservation. So the call center is a different aspect entirely. It has to do with tech, the tech aspect
Yeah.
of nursing. While I came back to the wildlife and conservation, it has been an eye opener. It has actually showed me how the environment plays a key role in our health entirely. It plays a key role in the water we drink, the weather itself. It plays key roles in our environment. And also, I know nursing doesn't have the nursing I'm practicing is not like a veterinary nursing, but there's this connection that I have with some of these animals we see in the wildlife conservation. I have this connection with them. I don't know, but it feels like I want to go into veterinary nursing. Or I don't know, but I there's this connection I have with them, and it has been an eye opener so far. So far, it has been an eye opener, and I'm glad I took the part actually.
Yeah, 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 yeah. So when you said that you work in this field, my my vision was that your primary focus was on other people working in this field. Is that it?
My primary focus are the people working in the environment, the people working once they get sick or there's a challenge, there's an emergency. I am the first contact before they are
hmm
moved to the
hmm
yeah.
hmm And I'm assuming that that puts you in the position to be. I can see from what you have already done that your temperament is what is of. somebody to be kind of innovative. And I'm assuming
Yes,
that this particular situation also and brings that out because I can
yes,
see that's not somewhere where you have like a hospital situation, for example, where everything is close by. You've got to become very think outside the box kind of thing.
yeah. Actually, it's not a hospital setting per se. You don't
Right.
have everything you need. You just have to improvise.
Yeah. 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 That's cool. That's cool. Um, I want to know when you look at what do you think you'd like to see change about nursing where you are?
I would like to see change in the nursing profession, especially in Nigeria, is nursing welfare.
Mm,
Nursing welfare is very poor over here.
hmm.
You find nurses trying to leave the country not because they don't want to stay and practice here, but because the welfare is very poor. Nurses also have needs, but there's no welfare to actually take care of nurses. Nurses hardly earn a good living here in Nigeria, and also nurses are overworked. They are overworked with underpayment. So if there is one thing I want to see change is nurses welfare, especially in Nigeria. If nurses
Hmm.
welfare can be improved, I believe we are going to have more passionate nurses. We are. I will not say I'm part of those that are not passionate, but I will say we are only few that are actually working passionately in the profession, because if we are going to see, we'll look at what we are supposed to get as remuneration,
Yeah.
or the benefits that is in for us. The benefit is little or minimal, but because of that passion to serve humanity, that is why we are still here.
Hmm. Hmm. Yeah, yeah, yeah. And that always gives me pause about particularly I'm gonna and let's talk about Nigeria now because I understand that the nursing education is a 5-year program.
Yes,
And it just seems to me that if you invest in a 5-year program for someone, then you would want to keep them. And so I'm
yes.
wondering where is the disconnect that says, we'll invest this much money and time and energy into educating someone for this length of time and then lose them because the remuneration is not adequate.
So that has been the issue in Nigeria. Like, and it doesn't bother the government at all to actually make it. I'm not trying to call out Nigerian government, but
Uh-huh.
I will tell you that about 70% of nurses that graduate don't see jobs. If we are going
Uh-huh.
to go by the ones that are working with government, you are going to see that we only have a fraction of nurses working in government agencies, while those working in private agencies are highly underpaid. Highly,
That's
like
it.
as low as $20 per month. Nurses are paid up till today. Like as low as $20 per month. You see a nurse receiving $20 per month. And when you look at the cost of living, that cannot sustain. So that is why you see most nurses after education, the next thing they just want to
Yeah.
leave the country. They just want
Yeah.
to go.
Yeah.
And it is an issue of concern, because if nurses keep leaving the country like this, then I'm afraid we are likely not going to have people to care for those that
Yeah.
need care the most,
Yeah. Yeah.
actually. So
Yeah.
it's an issue of concern, actually. It's an issue of
Yeah.
concern.
Yeah. I can see why that would be. I can see why that would be. You are doing so much. Personally, with your job, with your organization, and all of that. And one of the things that I want to know is, what do you do for you? What do you do to take care of you?
Hmm.
Mm.
This is a very big question, actually. It's not actually easy, because I wouldn't say I get enough rest, but I have had to sometimes step back, try to get some rest.
Yeah.
Just like you mentioned, my job, reaching the unreached, and apart from reaching the unreached, I partner with other organizations. I partner with even churches, other organizations that want to reach out to their members or their community, if they feel like, apart from my personal work in reaching the unreached, but if anytime there is a need, I try to actually avail myself. So I would say that it has not been easy, but I've been trying my best to step back, celebrate my little wins, and also to remind myself that resting is part of the job. I try my
Mhm.
best to get the rest that I can get, but it's not actually easy. I can decide that some days I can decide that okay, when I'm off duty, just like now I'm off from work. I normally have 14 days after 2 months. After 2 months of work, I have 14 days off. So I am off from work for these 14 days. I was supposed to just come back home and sleep. My plan was that I would take 7 days out of these 14 days to sleep, but that's not going to be possible actually. So I just try my best. The little time I get to rest, I rest.
Yeah. So you said after 2 months of work, you get 14 days off. That
Yeah.
means, so in my head, that you're working every day for 60 days and then you get 14 days off?
Yes.
Wow.
Yeah.
Okay.
That
So
is the reason I say nurses are overworked and underpaid in Nigeria. Yeah.
absolutely. Absolutely.
Yeah.
Um, is that because you're working in wildlife?
You said?
Is that because of your location?
Yes, it's because of the location actually. We are only two nurses in the organization. Okay, let's
Mm,
say three with a nurse assistant. We are two nurses, two registered nurses with one nurse assistant. So when it's time for me to go for my leave, we have another nurse that will come to relieve
that will
me while the
cover.
assistant will be in the other
Mhm.
location. We have two outlets in the location. So I think it's because of the job. And most times it's not like the job is too demanding, but I have to be there in case of any emergency. People don't get sick every day. Yeah, people don't
That's
get
true.
sick every day. But I
Right.
just have to be there in case if someone gets sick.
Mm-hmm. Mm-hmm.
Yeah.
Yeah. Understood. 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 So here you are. Um, what kind of role then um does technology play in your particular area?
All right. Technology plays many roles in my area. Okay, you mean like the place I work or in Nigeria entirely?
Actually, I meant the place you work, but we can do both, actually. Let's start with the place you work.
All right. Technology plays a role in the place I work. Sometimes we offer telemedicine, not officially, but it's a telemedicine service whereby when we have people in the far part of the outpost, people that are inside deep inside the forest, they have the first aid kit, but most of the things in the first aid kit cannot actually they don't know how to prescribe some of those drugs or other things. They will have to reach out to me. I will be
Yeah,
the one to say do this, do that. Sometimes when there is an emergency, let's say a bleeding emergency, they have the training of the first aid, but they will also reach out to me via the radio connection or sometimes via phone call. And I would have to, as I'm on my way to the place, I will have to still give them instructions on how to go about their duties.
that's
Then
yeah.
also in my previous role, the previous role I took, that's the call center nurse. That's where
Mm,
technology has been in play for the most because it's a call center role.
hmm.
I we get to, and it's a health insurance organization. So we
Okay,
get to issue prioritization codes. Many people feel like, just like you mentioned, nursing should be in the hospital or in the four walls of the
good.
hospital. But we get to give care, we get to render care at the back end. We get to approve prioritizations, we get to consult patients, we get to actually listen to their complaints, their inquiries, and also give them feedback, provide
Yeah,
solutions to their problem. I feel that's a way of actually rendering care in the back end, not where
yeah,
people see you, not the normal way that people are expecting you to render care, but at least we still render that care. A timely response to a patient's inquiry is also rendering care actually.
yeah, yeah, absolutely, absolutely. So when you look ahead, Let us say in another 10 years or so, because we just talked about technology and things in, as far as I'm concerned, are moving so very quickly in that area. When you look ahead, let us say 10 years or so, what do you think you will see?
Yeah, in the next 10 years, because the way things are going, I'm hoping to see telemedicine being more in play because one thing I noticed, people don't like going to the hospital. And when you just decide to render, especially, I don't know in your country if it's like that, but in Nigeria, people don't like going to the hospital. Someone will be sick and will have to pamper that sickness until it has deteriorated before they would want to come to the hospital.
Mm-hmm,
So, but
mm-hmm.
there are little steps that have been taken to actually provide telemedicine to these people, and I believe that in the next 10 years, this telemedicine will evolve. It's going to evolve into something meaningful and impactful, and also in even in reaching your unreached, I hope to actually bring in telemedicine to actually reach out to people in far distance, people that we cannot go to and cannot come to us, but with telemedicine we can actually do the least we can do for them. Then secondly, I also see, we're in the era of AI. I also see people, I also see better AI assisted diagnostics. I also
Okay.
see AI assisted diagnostic in the next 10 years. Those are the
Mm-hmm.
two things I'm envisioning in the next 10 years.
Yeah, yeah. And those things will probably be here long before 10 years, actually,
Yeah.
given the rate at which things are evolving. I probably. So I have one last question. What do you think you want people to say? What would you like your legacy to be? Because you're doing so much. As you told me, you partner with so many different organizations. You've created your own. What do you think you'd like your legacy to be?
All right. My legacy. I would want my legacy to be that people remember me as that young, passionate young person, or maybe when I get old, that passionate nurse who has always stood out for those who need care the most, who has always come through for those who need care. Beside healthcare, I don't actually believe that healthcare should be a privilege. I actually believe that healthcare is a right, and no
Mm-hmm.
one should go without it just because of where they
Mm-hmm.
are geographically located or where they come from. I believe that healthcare should be available and accessible to everyone. So I
Yeah.
want my legacy to be that tomorrow, if they will remember me, it should be that this is someone that prides on providing free healthcare access to people who need it the most.
That's huge. That's huge. That's
Yeah.
huge. That was going to be my last question, but as I'm listening to you speak, and I've listened to you all throughout this conversation, one of the things that strikes me is that your whole personality, your whole outlook seems to be about what can I do for others? What can I give? Where does that come from?
Mm, it comes from the community I grew up from. I grew up in a
Mm-hmm.
community where most times healthcare is a big challenge. Apart from healthcare, basic amenities is a big challenge. And you don't have anybody coming through for anyone. I've had to need help from so many people and I didn't get. So I took it upon myself that if I will have to need help from people and I don't get it, why not become that help to someone? So I've promised myself that the help that I didn't get from others, I will be that help. The assistance that I didn't get from others, I will be the assistance to someone who is going to need my help. So that's where it's coming from.
Yes, 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 yes. On that note, Shedrach, thank you so, so very much for this
Thank
conversation.
you so
It's
much, Ted, for the
enlightening.
opportunity. It means a lot to me, actually.
I hope we can do it again. I hope we can do it
Yeah,
again.
yeah, yeah, yeah. I'm looking forward to other sections, actually.
Okay, all right.
Yeah.
Are there any last words you'd like to leave us with?
No, not really. I
Not
actually
really.
enjoyed the session. I would just take out time to appreciate you for what you do for actually bringing nurses up. I've watched other sessions and I've seen how other nurses share their stories. I believe there are other nurses that want to do great. They want to actually come through for people. There are other nurses that want to be nurses leaders, but they don't even know how to start. But I
Mhm.
believe going through your page needs more visibility, because if other nurses should go through and see what nurses are doing, what nurses are doing out there, I believe it's
Mhm.
going to inspire a lot of nurses to actually, with the little they can, even if it is in their hospital setting, with the little they can. I believe the little act of kindness, no matter how little it is, a little act of kindness makes a difference. And
Makes
this
a
is
huge.
an act of kindness you are doing. Thank you very much for bringing us up.
The pleasure is mine. The pleasure is mine.
Yeah.
Thank you, Shedrach.
Thank you, Del.